No.
Sir,
No.
relax.
¿Qué? Este hospital es malo. No,
Let me
tú no es
explain.
útil.
Let me-
No es bueno. Mi
Sir.
sobrino es daño.
Okay.
No.
Alright.
Ay.
I am so fed up with this. I cannot understand a single word that he is saying. I'm sorry. He's your problem now.
Okay, let's see. Patient is a 20-year-old white male with a jaw injury and incapable of speaking. There seems to be a family member and some sort of communication issue with the relative. Oh my god, he hasn't done vitals yet. I better get started.
In the pre-interaction phase, the nurse reviews this chart with little information that it had. She also had to deal with the barrier of lack of caring from the previous nurse that was supposed to be caring for the patient at the time. The nurse is showing caring through knowing because she is avoiding assumptions made by the previous nurse.
Hi, I'm Alyssa. I'm gonna be...
¿Cómo te llamas?
Sir, it's okay. We're taking care of it. 1 second. I'm Alyssa. I'm gonna be your nurse for the day. I'm gonna be here until 7 o'clock. I see you have a jaw injury. Well, we're gonna do all we can to make you more comfortable. Are you in any pain? Yeah. How about on a scale of 1 to 10? How are you feeling? A 10? Okay. Well, I'm gonna go get you some medication to ease the pain. I'll be right back. Okay. First things first. Let me grab a doctor to prescribe some meds. I want to reduce the reported pain level to 5 or below, and I also need to get a translator for his uncle.
During the orientation phase, the nurse introduces herself, clarifies the purpose of the relationship, assesses the client's needs, identifies goals, thinks about how to resolve the communication barrier, and discusses termination of the relationship. She must prioritize between the patient's pain and the language barrier. She first addresses the need to reduce the patient's pain and then seeks an interpreter. The patient performs nonverbal communication, clutching his jaw with an agonized look on his face. Also, nonverbal communication is portrayed by the client's relative scowling as the nurse walks in and is speaking. The nurse is also actively listening to the patient by facing the client, maintaining eye contact, and appearing relaxed.
Thank you for being so patient. I have an interpreter coming so your uncle can understand us better. I'm just going to give you some pain meds to ease the pain, okay? Okay, it'll be quick.
¿Qué estás haciendo?
Oh, he's okay.
No.
He's okay. It's okay. It's okay. It'll be okay. I'm going to take a look at your vitals and see if everything is okay. Are you okay? Yeah? No, sir, it's okay. Everything's fine. Just be patient, please. Okay, I'm just going to put my stethoscope right here. 1 second. Okay, I'm just going to listen to your heart. Okay.
Hi, my name is Kayla. I'm the interpreter. Me llamo Kayla.
Encantado.
I'm sorry this situation hasn't been handled as it should have been. What happened to your nephew?
He said he's upset because his nephew has been here over an hour, and all the last nurse did was yell at him and tell him to speak English.
Well, I'm sorry that this situation has happened to you. What happened to your nephew?
He was playing in a hockey game and they were doing well, and then all of a sudden a puck was struck into the air and hit him in the face. It has been chaos since then between the hospital right here and the previous nurse.
I'm sorry again that this happened to your nephew, sir. But he knows that hockey is a dangerous sport and has a risk of getting injured. So just to clarify, your nephew received an injury by a hockey puck in the face?
Sí.
Okay, well the medication should start in 20 minutes.
He also wants to know when the pain meds are going to kick in for his nephew.
They should kick in about 20 minutes. Has he ever been hospitalized before for a hockey injury?
No.
No. Okay. And is he currently on any medication?
No.
With the help of the interpreter, Alyssa is now able to break down the language barrier and complete the patient's health history, which is a vital part of the working phase. She also uses touching the patient's arm as nonverbal communication. She uses a calm, even tone of voice as verbal communication, even when the patient's uncle is angry. She uses clarification as a verbal form of communication to fully understand what happened to the patient. By clarifying, the nurse is demonstrating Swanson's theory of caring.
Okay, Jack. Well, the doctor looked at your x-ray and you do indeed have a fractured jaw. To take care of it, we are going to fix your broken jaw by wearing it.
Are you sure? That sounds a little extreme. Is that necessary?
The doctor is confident that that is the best option for Jack. So Jack, the physician will come in shortly to explain the procedure to you. But in the meantime, I want to know that you are not in pain anymore? No? So here's a pen and a notebook. Jack, can you write down how you're feeling about this procedure? You're nervous and can't believe this is happening to you. Can you write more? You're uncomfortable and painful? Okay. I know you're nervous, Jack, but I'm here to answer any questions that you have, and hopefully make you more at ease. Oh, thank you. You're welcome, Jack, and I will be here for you when they take you to do this procedure. And just keep in mind, although this procedure will be inconvenient at the end of all of this, you will have normal jaw function again, and all will be well.
At the end of the working phase, the nurse shows Swanson's theory of care by being with the patient emotionally and physically before he goes into surgery and maintaining belief by reassuring him that his jaw will return to normal functioning after surgery. A barrier that the nurse deals with is the anxiety of the patient regarding his operation. She reassures him by confidently answering all of his questions and keeping his nerves at ease. The nurse also facilitates communication by giving the patient a pen and paper to write with.
Are you feeling any better after your pain meds? Yes? Okay, on a scale of 1 to 10, can you tell me what your pain level is? 4? Okay, good. Now that you can tolerate your pain level, it is time for surgery. Once again, everything will be okay. Our post-op jaw surgery has a wonderful prognosis.
The nurse uses medical terms that may be over the patient's head, such as post-op and prognosis. To make sure communication is clear, the nurse should use different terms or explain the medical terms she used.
I'm not going to be here after your surgery, but I just wanted to make sure you're all educated on everything that's happening. I'm going to leave some pamphlets and resources in your room. I'd like to point out you'll have to slowly ease onto harder foods and sleep on your back for the first month or so. Do any of you guys have any questions?
No, gracias.
No? Okay. You're welcome.
In the termination phase, the nurse reevaluates the patient's pain level, plans discharge, and says goodbye to the patient. The nurse demonstrates enabling by giving pamphlets to transition from pre to post-surgery and by explaining dietary and sleep restrictions.
My name is Kayla and Jessica as the interpreter.
Hi, my name's Alyssa Walker and I was the nurse.
I'm Jack and I have a broken jaw. Oh!
My name's Kelly. I'm the disgruntled nurse.
Hey, it's your boy Stefan. How's the difficult uncle?